All right, Kelsey, thank you very much. Well, in our Ask the Doctor segment today, we know that exercise is good for all of us. But what about exercise when you are pregnant? Well, Dr. Justin Aldred, he is from OBGYN South, PC, which is a part of Brookwood Baptist Health. He's here to talk about that this morning. Good morning.
Good morning. Thanks for having me.
Welcome home.
Yes.
I know you grew up here and left for a while, and now you're back.
Yes, great to be back.
It's good to have you. All right, well, let's just start with our first question.
Okay.
Is it okay to have physical activity, or how much when you are pregnant?
Absolutely. It's absolutely okay to be physically active. It's actually recommended by the American College of Obstetrics and Gynecology for healthy pregnant women to have, on average, about 20 to 30 minutes of moderate exercise on a daily basis on most days of the week.
We see it a lot now, but you know, history has shown us the stereotypical trying to help a pregnant woman because you think, you know, she can't do much because she's with child, but that is not really accurate.
It's not. It's actually highly recommended. It's good for the mental status of the patient, but also for the overall health of the patient. And so something we commonly talk about in the clinic, and it's something that we absolutely recommend going forward.
I would imagine, though, too, if you are already active and do certain things, you can do that. But don't start a physical exercise regimen after you're pregnant if you didn't beforehand.
Sure, yeah. So it is recommended that you certainly want to consult with your medical professional, whoever your physician is, and come up with a routine that's adaptable to you, something that can help you achieve your goals during the pregnancy. And it's something that I think every medical professional, especially OBGYN, should have that conversation with their patient throughout their prenatal care.
Any risk?
There is some risk depending upon, it's on a patient-to-patient basis, and that's why it's important to talk with your doctor. But no, for the average healthy pregnancy, there is little to no risk with exercise, moderate exercise on a daily basis.
Does it have any effect on, and one of the questions was on nursing or breast milk if you do rigorously exercise?
Sure. No, there has not been proven to be any kind of adverse effects on breast milk production. However, just from a standpoint of comfortability, when you do exercises, you do want to maybe pump or breastfeed prior to the exercise to make it more comfortable for you to do the exercising.
All right, let's move along to after you've had the baby and exercise.
Sure. Absolutely recommended again, and it can really help with your persona to lose weight, to get back to your normal pre-pregnancy weight. Can really help with your mental status, and so it's something that we certainly want to at least begin after delivery, and it's going to depend upon patient to patient depending on what type of delivery they had, if it was a C-section or a vaginal delivery.
Because recovery is going to be different for everybody.
Exactly.
All right, so is there anything you should avoid, any kind of exercise a pregnant woman should avoid?
We typically like to avoid high-impact sports. You want to avoid high agility sports because your balance, your center of balance is off during pregnancy, so it's important to avoid fall risk and things like that that could put you and your pregnancy, you and your baby at risk during the pregnancy. So really try to avoid those types of things, but you know, brisk walks and aerobic activities are the things that we typically recommend.
I know it's good for you as the mom, but does it help the baby at all when a woman is more active and exercise?
Postpartum? Yes, it does. I mean, I think if the mom's mental status is healthy, then that translates into better care for the infant at the home. And so also just the overall persona, it stimulates really just a sense of well-being within the mom, and so a healthy mom, healthy baby.
Which is what we want.
That's right.
All right, Dr. Justin Aldred, thank you.